what will people say if me, I'm a doctor and I'm there with a mental illness? The society, the larger population. And that I'm a doctor. Because, and also they tend to be stigmatized by other people. Because I'll see on the junior people, they are easily approached. But now to reach a doctor may be a problem. People may feel not comfortable, and they fear the fear of unknown. What will the doctor say? If I tell you, Daktari, you need to see a doctor. Sometimes also they stigmatize themselves because many times they may think, I don't know why they feel, they are also not human beings and they need attention. So they stigmatize themselves unknowingly or knowingly, and they are stigmatized by others.
What happens if you learn that the doctor that is attending to you is on treatment for a mental health issue, or that nurse diligently nursing you is struggling with something similar? Have you ever sat down to think about what the healthcare providers go through while attending to your health, or even wonder if their work has any psychological toll on them?
Well, from my experience, not even before we refer, we go to any literature, it's not easy. One thing, there is a lot of stigma. If I'm the one looking at the sick, if I'm the one looking at the mentally ill patients, what will people think about me? What will they say? They will always be thinking that their patients are being managed by the mentally sick. So they tend to run away from reality until maybe somebody somewhere forces them. It is a bit difficult. They come up to say they are mentally sick, but unless they get somebody they trust to confine with, and then they are encouraged. Those are the people you see coming forward.
The field that we are in, we are people who are we consider ourselves self-reliant, self-sufficient. We are the people who are able to perform better than others. So self-stigma comes in the fact that how will other people look at me? Does having a mental disorder make me a weaker person? Does it make me incapacitated in the ways in which I will perform in terms of my career? And most people believe that the moment I say that I'm depressed, it means that I'm not able to perform. I'm not going to treat my patients. Or they actually imagine that the moment they're told that they have a mental disorder, it will make the seniors or the board remove them from practice, especially those like the surgeons who need a lot of precision to do their work. So the easier way is to not do it, or not say, or not come out with it, or self-medicate until when things are off. And then you find that the self-stigma even happens with cadres. You find that there is a lot of stigma postulated towards a psychiatrist. So I could be going through issues, but just that the fact that people expect psychiatrists to be dysfunctional, and honestly we are not, makes me want to stick into my cocoon, not to say, because I do not want to satisfy people's ideas or myths about who a psychiatrist should be. So there's a lot of self-stigma, and there's also the institutional stigma that the moment you're presumed to be an alcoholic, then what do we do first? Instead of helping you get help, we remove you from practice. We put you aside. We put you on leave. And nobody then goes forth to find out how should we help you further to regain yourself back. And there's that gap.
I learned quite a number of support groups, both sexual violence and depression groups, but not a single doctor is in those groups. I have some nurses, I have some supportive staffs, I have other disciplines from other ministries, but I can't tell I have any doctor.
I'll speak from my experience, and I had been privileged to run a clinic in Chiromaland Medical Center where we were able to see over 50 doctors coming. I think stigma, not more to the healthcare provider, it's only that most people will imagine that doctors should not break down. Doctors should not be affected by anything, to a point that if you come and you find that your clinic is not functioning and you say that you're sick, people don't understand. But stigma cuts across. It's not more towards the doctor, it's just broadly towards mental health. And that means that even if you're a doctor or you're a nurse or you're a psychologist, knowing the stigma postulated to someone with a mental illness, it becomes very hard for you to open up or health seek.
And that there might be the biggest hurdle, the stigma. No healthcare provider living with a mental health condition was willing to talk about their journey.
Honestly, working in a psychiatric facility that is inpatient can be very draining because you get all sorts of patients who, because you have a human heart, you can see this person is really not doing well, you know? And it's not like when you're in a medical ward where you can see, you know, if I have a scar here, you can see. Then when you see it, your brain can help you imagine how painful it is. So you feel more for the patient. But when it's mental health, when you look at them, they don't have any injury, they don't have anything, but the way they are behaving, you know, so, and you know, trying to understand someone from that perspective and just being there for them, despite them telling you, when some of them are having their episodes, some of them can be very hostile, some of them can be very mean, some of them can really abuse you, and you also feel a bit hurt because you're a human being. So learning how to always tell yourself, because of the nature of the disease, I want to believe that this is not who you are, and I will help you get out of this place. When you're in a facility where there are more than one of them who is behaving like that, it can be very overwhelming.
There is no research that has actually been funded to actually look at the healthcare provider, and there's been reluctance in terms of people wanting to find out if there are many issues. But currently we have one research that was done by a student that showed that the perceived stress of medical students was higher than in other cadres. And we are also seeing other people who are coming up to do the study, but yet we have no results. The awareness was not there that there is an issue. But currently now, so that we are seeing a lot of suicides actually attributed to doctors and even students, actually, the students doing medicine. So most people are now starting to see their interest. But originally, mental health was not seen as an African phenomenon. It was more of a white kind of thing. And nobody ever thought that an African would actually get to the point where they're depressed, they cannot cope with their stress. But as times have changed, it is becoming prevalent, and there's a rise in those incidences. In Kenya, we don't have any statistics to actually depict the depth of it, but some have been done abroad, and it's actually showing that in comparison between the health worker and the common person, the mental health issues or the challenges that are affecting mental health workers are 2 to 4 more times than what is there in the common aspect of the common person.
Several studies and reports show that healthcare workers, and particularly nurses, are more stressed than other workers. They routinely work with patients who bring to them painful and often challenging problems, and they routinely make decisions that have serious effects on people's lives. Despite all this, healthcare workers, and especially doctors, are the most reluctant to seek help.
Nurses and the supportive staffs. But with the doctors, it's I see very few.
Men rarely admit to having issues, or they believe that they can handle them. And it's interesting, when you look at a healthcare provider, everybody knows that we know these things. It's things we've been trained from. So it's not the fact that they are not aware, or they don't know that depression will present like this, or that I'm moving from just a user of a substance to now to dependency. They are aware. And that's where we look at things to do with insight. Intellectually, we are able to understand, but we don't connect it emotionally, what we call emotional insight, that beyond what I have learned in school, or what I know about addiction, or what I know about depression, am I affected? Am I becoming dysfunctional? Is my family breaking down because of this? That becomes a very big predicament. In fact, even when they come the few who do come for health seeking, they're very rash. They want to rush the process. They don't want to sit in through the whole session because they assume they already know the diagnosis. And in fact, they will dictate on how you should do the treatment, becoming a big hindrance. And someone will not even come back for review because they tell the doctor, but I wrote the prescription myself. I went and refilled. But they forget that beyond just what they know, there's a lot that goes into their care, including psychotherapy. It is one thing. It's actually the issue that is impaired in all of them. The fact that you feel that you know, or you are aware, or you understand. And that just means that you don't come in time You come when things are so dire, or the situation is beyond you, or you're in a place where you don't understand what is happening to you. Because we have had situations where the hospital is forced to go for doctors, even from their workplace. We're told that now they broke down, they're violent, and they're causing commotion, and we have to go get them. But this is someone who actually saw this coming. They were able to see themselves withdraw, to feel the sadness, to feel the suicidal thoughts, but they assume and they continue pushing themselves to a limit where they break down completely.
I think it's an issue, just a silent issue. You find people will go through a lot. I would talk from the point of a psychologist because that's what I do. We spend a lot of time with the patients and we have very many interactive sessions with them. We are the ones who help them through whatever they are going through. You know, sitting down with them, asking them what happened, how can I help you, asking them, okay, you know, trying to uncover, trying to get the underlying issue as to where this problem started. Or just basically trying to help them cope with whatever they're having, because patients are different. There are those who come in who have never experienced whatever they're experiencing. So it's something really fresh for them. You have to do psychoeducation, you have to know what you're saying, you have to, you know, be somewhat a support system, especially when they're inpatient. Then you have other patients who come in who have had this condition for a long time, or would say that they have always known there's something but they've never really gone to seek help. You have to be, you know, there with them to support them and help them through it. So you go through a lot as an individual who spends a lot of time with a patient, especially psychiatric patients, because those are patients who maybe have some form of a chemical imbalance, or because of genes they're going through what they're going through, so they need medication, you know. So you have to be there and give them the support that they need.
Sometimes it's difficult for you to tell you have a problem when you are dealing with the people with the same problem. You kind of go into denial. And the pressure of work they have, many times I've seen like they don't have time for their self-care. They are more concentrating, they are more solving other people's problems, and they tend to forget that they can also, to appreciate, they can also have a problem.
The most common that we see is depression and anxiety. Because you see, depression majorly is the breakdown of how you cope with your systems. So depression and anxiety comes more prevalently. Then you'll find that now suicide as a result of depression and anxiety is also seen. We've seen a rise in suicide, committed or parasuicides, the survivors of that kind of aspect that have not been able to completely, becoming very high. But also in the other dynamics, we also are seeing a lot of substance abuse, majorly alcohol and prescription medication, because you're able to access this kind of medication. You can even write for yourself a prescription. So you find things like benzodiazepine, opioids, pethidine being one of the most prevalently used, because you find it in theater. Doctors are abusing this a lot, and even healthcare workers, including the nurses. You are pushed to perform, and that means doctors will not be able to sleep properly, or you find that they have spent a lot of time with lack of sleep. And then on top of that, you'll find that people use psychostimulants to keep themselves awake so that they're able to provide. And doctors are people who, or can I say healthcare workers, they're ambitious. So you find that while they're trying to work, they try to do a lot of other things on the side, including masters, PhDs, things that keep them more awake and destabilize their sleep patterns. And then burnouts come into this situation, because of course you're stretching yourself with whatever you can do. You are not able to cope with everything. And then you find that a burnout leads to a breakdown leads to depression, and you find that depression becomes suicide or sometimes complete confinement. You know. The issues come from the work environment, and also we have the home front. From the work environment, a doctor is one person who, the working hours are very long. There are different issues to do with the number of people who are actually providing the service. We are less, but versus the number of people we're supposed to serve. So you find that doctors will do 40 or more hours. Someone will be at work for more than 24 hours. They put a lot of input in it, and that means that they get a lot of burnouts. Then you find that the clientele that we deal with, people expect a lot from the doctor. They expect mostly what is not even manageable. And you find that when they do not get the results that they're seeking, they go ahead to do, some even go to physical abuse or even verbal abuse. And of late with this kind of social media, you find that the doctor has become a target. Every time there's a small incident, whether they don't understand the nature of it, you'll find them on social media. And that actually has provided to more stress because doctors are not comfortable with dealing with the kind. They're always worried of who is watching, what is being picked by cameras, and what will be put out there. Then you also find that the relationship between the doctors and their seniors has never been as good because we don't look at each other as colleagues. You find that the seniors become very abusive and very stressful and demanding from the lower cadres. And even between the doctors and the nurses, there's that gap, the feeling of superiority, and you find that the nurses suffer the brush. Or you find now the relationship between the nurse is having an issue, and also it affects the patient. Then beyond that, you find that we deal with a lot of stress. Patients come telling you their issues, and you're supposed to deal with all this, absorb it, with no debriefing. So where do you take all this energy, or negative energy that you've picked? It's internalized. And this is also a doctor who has his own issues dealing with. So when you find that all this is consolidated inside, the coping system actually becomes broken. And that's when you now start seeing anxiety issues and depression.
People are different and people have different ways of coping. What I intentionally do when I leave the hospital, I tell myself that I'm leaving the things I have had and the things I've experienced at the gate. So it's like a mental activity that I do, that I say, now I'm going home, it's time for home time. It's time for me to go and do things out of. And sometimes you find yourself thinking about, I saw this patient, he or she said 1, 2, 3, and you can really feel very sympathetic, not empathetic, sympathetic, to the point that now you can go home thinking about them and you're completely consumed about them. But once you get that thought, you cut it off and you tell yourself, no, this is something I will do tomorrow in the morning when I go back to work.
In the recent past, there's a lot of growth that has happened in the Mental Institute and in terms of psychoeducation. And the awareness, I think, that started in 2016, the campaign of Physician Heal Thyself. But as much as they've been trying to psychoeducate and create awareness, there's more that needs to be done. Beyond just making me aware that I have depression, what else is available for me? Being civil servants, and I'm not talking about those who are in private practice, NHIF has made it very easy for the healthcare provider to seek medication or seek assistance. And that means that you can go to any mental hospital and you're covered fully. That really helps. But beyond that, there's still a lot to be done. There's still a lot to be done. Because while you look at other corporates where we have wellness clinics, what is there for the doctor? There are none. There's nobody who's going to the hospitals and sitting doctors down and telling them, this is what you should look at yourself. Do you even know your sugars? Do you even know your BP? Have you been assessed? And again, institutions have gone ahead to even have in-house psychologists who are go-to people. And that means if you're in a hospital where that kind of facility is provided, if you're going through any traumatic event, whether personal or environmental, or whether from patient, because sometimes we have those altercations, there's somewhere you can go sit and be debriefed, but we don't have those. The facilities of mental health like Shiromalen and Oasis have started what we call debriefings. Every end of the month you sit together in a group kind of session whereby you talk about your challenges and beyond just the practice itself and even from home, what exactly is making it difficult to be truly 100%. And that means that if it's private, you can have individual sessions, but if you're able to speak about it, you share and you're able to help each other. And how did you cope with the situation?
At the end of the day, you're a human being. You don't want to look like you're unqualified or insufficient. And sometimes you can feel like that because when you have, for example, patients who have substance abuse, they can be very difficult to handle because addiction is a disease. It tampers with the way your brain works. So even when you're having the session with this patient, you think you've reached far, and then they have a relapse. You can start feeling like, oh, okay, what didn't I do? What is happening? You can really blame yourself, but you have to keep on remembering at the back of your mind that this is the nature of the disease. This is how it goes. So even when they do have a relapse, it's not my fault. I did do my part, and now I'm ready to help this individual again, instead of getting to that place where you're feeling, so when you're having those debriefing sessions, being able to say it in a a safe space, an environment where you can air your issues and say how you felt, you know, what you experienced, even express the feeling of maybe I didn't do it, maybe I'm not the best person, you know, expressing all your insecurities, putting them out there. If you have any maladaptive way of thinking, being able to get a new way of thinking and move forward. You have to know where to draw the boundary, because what happens is you can become very attached to the patient to the point that you feel like, if I don't do this thing for this person, you know, it's like you're almost giving yourself completely away to them. And that is a dangerous place to be in, because when you become attached, you can feel that responsibility to, you know, to go the extra mile, even in the expense of your own health. So understanding where to draw the boundary, getting to the place of understanding where if there's something wrong and you start feeling like this session is not progressing well or I'm becoming attached, what do? You refer. You know, there are so many channels that you can use to help yourself. You can take a break. You should go for debriefing sessions where you're able to sit down with another therapist and just unpack what you've been going through, talking about it, because some of the cases are very traumatizing. There are some things some patients tell you and then you feel like, you know, but you can't show, you have to be very composed. So you can get to that place where now you're just suppressing everything inside. And you suppress long enough, one day it will. So you must have an outlet. You can have structured sessions, so that the supervision sessions where you go to a professional who helps you have the session to debrief and to unpack. Or just, I mean, even talking to your fellow colleagues and telling them I've experienced 1, 2, 3, and now being able to refer a patient. But it's not a good idea to keep it inside and to, you know, keep it to yourself. That can be very detrimental.
Family support is very important because, you see, most of the mental disorders, what they take away from you is the insight, the awareness that you're going through something. So that means other people who know you better should be able to identify these issues and be able to give you the right kind of direction of where you should be assisted. And the family has a greater role in that because they're the people who know you from childhood. They can tell a change. So they will actually purport and help you to health seek. On top of that, just that psychological first aid that you need, because you don't just wake up one day. Of course, there's the acute psychosis or acute illnesses, but most of the mental disorders are slow progressing. The first people to give psychological first aid are the family members, to come into there and play and find out what is the issue, where can we help? Is it the work front? Is it the home front? So that they diffuse a situation before it becomes too dire. On top of that, once the illness has developed, we need a lot of also that support system and also the financial aspect. Because beyond just the fact that we have insurances, sometimes you find healthcare becomes very expensive, especially here in Kenya, when you exhaust your own cover and who will support you to continuously get that help. So the family comes into play here. And also to just cushion you, because we are also family people. You have your wife, you have children. When you're sick, who takes care of them? It helps to know that holistically you're being supported. Currently, we're seeing a lot of altercations in terms of the people attacking doctors or people attacking nurses because they feel that they've been hurt or they're the reason as to why the outcome of the patient didn't go well. And that means that in the environment there's also a security to be provided. And in case of such kind of events, where does this person go? Is he given time off? Is he given time off to seek for this help? And who is there to provide it? We have gotten better, but we are not yet there holistically. That is what I can say. Even the revision of the working hours has not been done. Even the fact that the number of healthcare providers is still not matching with what is needed by the WHO has not been addressed. So we are far, but we are yet to actually get to the point that we need to be. And I would encourage doctors to seek help, to be treated. We are now having more facilities opening up. We are having more trained psychiatrists coming up because that was also having an issue, a gap. Yes, you know you're sick, but where do you go to? Who do you go to get the help from? So those are the kind of issues that need to be addressed.
You have to give them a conducive environment. You have to assure them confidentiality. You have to be good to them, listen to them, show them a caring heart, show them they are also human beings, and with that, they are able to ventilate. They are able to tell about themselves. And once they understand that once they see and they observe both verbal and non-verbal, once they see you are ready for them, they tend to feel comfortable. They tend to pour out, and they tend to discuss what they have never discussed with somebody. And you are able to work with them.
Mental illness is chronic. It does not, there are those that incapacitate you, but majority of them, including depression and anxiety, some actually go to full remission and you actually perform as normal. The most important thing is to know that you have to take your medication according to the way the doctor has prescribed, and this has to happen to help you be able to function better. But majority of the disorders are actually treatable. There are some conditions that will impair decision making and actually functionality to some level. But it doesn't mean that all conditions do that. It is important to also understand your doctor. And that is the full function of the environment at work. To know that this employee, what are they struggling with? They do their own assessment, just like the pilots do, to understand what level of impairment are we facing and what is the ability of this patient post-treatment, what can they execute? And they assist in making those kind of decisions. Can we actually have this patient being a surgeon, or should they just do other normal duties that they are able to handle? But in generality, things like depression and anxiety, they completely, once you're managed well, you're stable. You can execute all your functions as if before. If that understanding is there, we might see a support system or patients who understand and they help. And also, the ministry and the government needs to do a lot in terms of the environment of the healthcare worker, from safety, from providing equipments, from actually giving them time to actually have this kind of support system, from incorporating all these policies that see the work environment being a mental health supportive environment. That means having the in-house counselors. That means having the support groups. That means the insurance supporting them in terms of health-seeking behavior. All that incorporated.